Over the last 25 years, it's estimated that 500,000 people have died from overdoses related to pain-relieving drugs. They call this the opioid crisis. Now, many of these are prescribed short-term, so if you have a back injury, leg injury, something like that. But then people get hooked on them and they can't wean themselves off and they become addicted. Now, I am watching, and I've been talking about this week, a series on Netflix and called Painkiller, part fact, part fiction. But each program is a drama thing, and each episode, Ellie, starts with a parent saying, you know, some of this is fictionalized, most of it is not, and certainly what is not is the death of my daughter or my son or whatever, and they show a picture of that person. And it shows how people become addicted to these painkillers. And it is, there are two series. There's one on Disney Plus, I think, and there's one on Netflix, which is called Painkiller. Have a look.
You ever prosecute a company as big as Purdue Pharma?
All of human behavior is essentially comprised of two things. Run from pain, run toward pleasure. Pain, pleasure, pain, pleasure. If we place ourselves right there, between pain and pleasure, we will never have to worry about money again.
They have a drug and they talk about how to sell it on this drama, which happened in real life, and it's called Oxycontin. And I thought...
I've heard of that.
I thought it was fictionalized, but it's not. It was real, and they have Oxycontin toys, and they have Oxycontin seminars, and their salespeople are on big bonuses to flog this stuff with tragic results.
Well, there's a lot of money in it, isn't there? But it's not just a problem over the Atlantic. It's been described as an epidemic here in the UK too. Well, we're joined this morning by Ella McCrystal, a clinical psychotherapist. Good morning to you, Ella. Very good to see you this morning. I mean, this is a very, very serious issue, isn't it? Because opioids are very addictive.
They are, and the problem is that when people are in pain, they are desperate. One of the biggest issues with pain is it's life-altering in so many different ways. It's not just about reducing pain. When you take these painkillers, there's a sense of euphoria that you gain with it, and you're able to continue with your daily life. And that brings with it changes in your family life. If you're suffering with pain, your family life is affected. So it's addictive for lots of different reasons.
Yeah, it's so sad, Ella. I don't know if you're watching one of these series at the minute.
I've just started.
Yeah, and that's addictive as well. It's addictive watching it as to what goes on there. But Ella, the thing is, when you have pain, and I speak as someone who's had terrible back and leg pain for a couple of years now, you would eat horse poo if it worked, really. But the thing is, the difference is that horse poo isn't addictive, that Oxycontin was addictive. They knew it was addictive. They upped the dosage on it, and they just made billions and billions of pounds for the expense of the misery of so many people, which is sad to watch.
Well, let's not forget how really, I mean, this stuff is so hard to withdraw from, and it's dangerous. The problem is that as people, as you mentioned, there are so many deaths because of the respiratory depression that happens when people are withdrawing and when people are hooked on this stuff. And I believe there was over 2,000 lawsuits and allegations against that company, and they had to, you know, they had to shut down as a result of it because it's so dangerous. But here in the UK, it's a massive issue as well. When we take opioids, the dopamine is released in the brain, the sense of euphoria. And like I say, and as you know, Eamonn, if you are in a lot of pain and you take something that allows you to continue with your life and improves your life, you're going to keep taking it. And if you keep upping the dosage for people, they're not going to be able to get off because of the complex changes that happen in the brain.
I can imagine it's not just the physical pain as well, it's the emotional pain of living with an injury, living with pain, living with sickness. If an opioid numbs that and makes you feel good, you can see just how addicted that would be as a holistic approach.
Of course. And, you know, if you're getting a sense of euphoria because of a painkiller, you can't help that. And that tolerance, like I said at the beginning, the tolerance is going to be affected the more you take it. So what we end up with is people that haven't been given the right support in the first place because obviously we're not educated about pain. And I know that GPs feel like there's not enough training in their medical school, in the primary care, around pain management. So what happens is those GP appointments are highly emotionally charged. People are desperate. The GPs don't have enough time to deal with that in that moment. They prescribe the painkillers, but there isn't enough multidisciplinary care. I own a multidisciplinary health clinic where we have physios and osteos and gut health people and people like me, psychologists and psychotherapists. And we know the benefits of looking at this in a multidisciplinary way. Exercise, food is a massive one. Gut health is a massive one in terms of mood. And then, being able to use behavioural therapy and trauma-focused therapies to deal with the problems of not only addiction, but like you say, the associated anxiety and depression.
You see, Ella, it's fascinating listening to you. I mean, I'm a classic case for you on this. And of all the people that I would go and see and the experts I would go and see, which would be most days, and I'm going today to get my back stretched and my neck stretched and various things, you, Ella, as a clinical psychotherapist, wouldn't even feature on my list of people to see. And if you did, you would be bottom of the list. So what am I missing out on? What is, for people like me who, I've come through a lot and I've advanced in certain things like being able to sleep at night, getting rid of pain there and whatever, not through tablets, but through surgery. But what can you offer a person who suffers acute pain?
It does depend on the psychotherapist. I take a multi-model approach. So I look at things like pain management or depression management through lifestyle choices. I work in a trauma-informed way as well. So if there's a history of acute stress or trauma, we look at that first. We know that the way that stress works is cortisol is released, adrenaline is released, which is inflammatory for your system. So if you're in pain, we're looking at the mechanical issues within your body, but also associated inflammation. So breathing techniques, behavioural changes, looking at whether you're moving your body. And when you go to see a psychotherapist, they're often working as part of a wider team. So we can cross-refer and make sure that you get the right targeted help rather than just medication. Although that is sometimes needed, we need to take a multi-model approach.
Yeah.
Meditation, relaxation, like I say, diet is a massive one. And I know you spoke about that earlier, but
we did speak about it earlier, and I think this is amazing to hear about inflammation and how it and what causes inflammation and what inflammation does to your body. Ella, I would love to talk to you for longer today, but you've made us aware of the role of psychotherapists in all of this as well, and that there are other options besides pills.
Yes.
So maybe we'll come back and we'll talk about it again some other day. But Ella McCrystal, enjoy the rest of the series. It would be very entertaining if it wasn't so true. And that's Painkillers on Netflix. Thank you very much.
Thank you so much.
Thank you. Absolutely fascinating stuff, isn't it? A lot of it comes down to food, doesn't it?
Well, but you'd like to know what is the food that's causing it? Is it sugar?